PowerPort contrast medium flushing and trapping, impact of the temperature, and in vitro experimental study. Good morning everyone, I'm Pierre Marcy, a French interventional radiologist in oncology, and my work is mostly dedicated to central venous access. Gérard Guiffant is the first and corresponding author and is professor of physics in Paris University. Dr. Jacques Durussel is an anesthetist and last author and has a 40-year experience in central venous access. The other authors include Jacques Durussel, Laurent Royon, and Professor Patrice Flaud. As you probably know, central lines mostly include PICC lines and central venous catheter port devices to safely perform intravenous infusion, including chemotherapy, blood transfusion, antibiotic therapy, supportive care medications, parenteral nutrition, and so on. Recently, PowerPorts understand high-pressure resistant ports have been developed to allow high-rate contrast medium injection, more than 2 ml per second, at patient CT examination. As a matter of fact, using contrast medium allows a better definition of the CT image and, of course, vascular and cardiac CT imaging. Using PowerPort injection during CT examination thus avoids performing a supplementary venous access, namely in patients without seaming superficial veins at their upper extremities. Thus, as this issue can be developed worldwide in daily radiology practice, the paper aims to respond to the following question. As contrast medium are viscous, is there a significant part of the contrast medium to remain trapped into the device despite a correct saline solution flushing? If so, what are the best parameters of flushing to limit the contrast medium trapping, and what are the potential risks of trapping to the patient? Our results, they show that hydrodynamics and temperature are two key parameters involved in the quality of contrast medium flushing. The best results were obtained by heating the flushing saline solution at 37 degrees Celsius, associated with a Huber needle bevel directed opposite to the port exit. In such conditions, there was still 70% of contrast medium to remain trapped into the port chamber. Interestingly, only the first flushing syringe fraction gave significant flushing of the contrast medium out of the port. What are the potential risks of such device contrast medium persistence to the patient? That means a potential seat of pollution. That means that persistence of contrast medium into the port chamber might lead to production of device lumen salt precipitate into the device lumen, mostly the chamber, with a subsequent risk of device occlusion and secondary device explantation, and long-term delivery of substituted benzene nuclei into the patient's circulation. Future potential developments include a lower viscosity contrast medium and new dedicated materials to increase the contrast medium clearance out of the device. I thank you for your attention.